So one of the questions which a lot of patients ask me is, what is the all-on-4 or teeth in a day solution? Is it really real? I think you've seen from our previous videos that we do a lot of this at Anacapa Dental, and we do it very predictably. So I'm going to answer the question in a different way. What does Anacapa Dental do differently than other practices out there that are doing the all-on-4 dental treatment procedure? So when we talk about all-on-4, it implies that we are placing just 4 implants, and in some situations that may be necessary where we're only able to place 4 implants. Now, I've been doing this now for the last 15-20 years, and I can assure you we've seen many patients, and there are some patients I wish at the time we had placed more than 4 implants because I couldn't predict the future. So today we like to place additional implants, and we place additional implants in patients that are, heavy grinders, patients who have suffered from gum disease, patients that have compromised medical histories like diabetes. We want those additional implants just in case, right? I've never heard a patient complain to me that you placed more implants than less. Now, as a patient, you're probably wondering, if I place more implants, or if we place more implants, is it going to cost more? At Anacapa Dental, it does not. Whether you have 4, 6, 7 implants, it all stays the same. Our goal here is to provide you with a restoration which lasts a long time. Now, what is the second difference between your traditional all-on-4 and the all-on-4 plus solution that we provide at Anacapa Dental? Now, traditionally, what you'll see, the prosthesis has tooth and it has pink. The pink portion is where it's replacing your gum that you've lost. And the traditional all-on-4 procedure will require that the bone be cut down and replaced with an artificial pink material, whether that be pink acrylic or pink porcelain. Now, we like to be a lot more conservative. So we try to maintain your bone, we try to maintain your gum, and we try to replace just the tooth portion. If I was to ask you, would you rather have artificial pink or your own gum, I'm pretty sure that you'd want to say that I want my own gum, and that's what we try to do. It's a little bit harder to do, but much better for you in the long run. So the first thing we do is we place as many implants as we need. We're thinking of the future. The second thing we do is we do it conservatively by maintaining your gum and maintaining your bone and only replacing the tooth part. Now, what's the third thing that we do? Many patients come in with very loose teeth, and one of their chief complaints or fears, should I say, is what if we make an impression and the tooth comes out? Now, that would really be a disaster, right? You see a dentist for the first time, they make an impression, the tooth is loose and the tooth comes out with the impression. And I can tell you, 15, 20 years ago, that happened to me. But today, we don't have to worry about things like that anymore. We have what we call intraoral scanners. It's like a wand where we scan the teeth, and as we scan the teeth, we build a 3D printed model. So we're utilizing digital technology to be able to make your procedure seamless. So whatever you're worried about as far as missing teeth or loose teeth, you don't have to worry about it anymore. So once again, to summarize, we place more than 4 implants. We minimize the reduction of bone, we maintain your bone, we maintain your gum. We utilize digital technology such as intraoral scanners, CT scans, and even face scanners and 3D print models. Now, the final restoration, what is it made of? The final teeth, because that's what you're going to be interested in. Now, many places do acrylic to titanium. Essentially what that is, it's plastic over a titanium substructure. Now, we used to do that 15, 20 years ago. We don't do it anymore. And the reason we don't do it anymore is that the acrylic or the plastic teeth, they wear down very, very quickly. So we like to use a stronger material such as zirconia. And what we do the zirconia very differently. The majority of the substructure is made of zirconia, and we layer it with porcelain to provide you with an aesthetic result. We want the teeth to be bright, but we want them to look as natural as possible. So when you're smiling, laughing, you're out with loved ones, essentially you don't have to worry about people noticing, oh, have they had something done? Now, the last thing that we do at Anacapa Dental, which really most of our patients are very grateful about is that we provide a warranty with what we do. And our warranty is based on a couple of things. One, that you attend recalls with the hygienist at an interval that we see fit for you. And the second thing is you wear a night guard to protect your teeth at night. What a lot of people don't know is that when you have implant teeth, you can exert a lot of force. And sometimes at nighttime, you can exert up to 800 pounds of force at night. And you can imagine what that can do to your natural teeth, let alone implant teeth. So we do provide a warranty for you so that you can have peace of mind that if you have something done, God forbid, if you have trauma, if you fall over, something happens, we will take care of it. So I hope that gave you some information in regards to how we do the All-on-4 process a little bit differently, a lot differently should I say, at Anacapa Dental. And all of these things have been designed with you in mind and with tons of experience of treating hundreds and hundreds of patients in the area. I certainly hope that information was valuable for you.